We are hereby trying to just dispel certain common misconceptions which are associated with pregnancy. The first one I'd like to talk about is the commonly asked question in pregnancy: what is the correct position that one should lie on while pregnant? In the first trimester, that is up to the first 12 weeks of pregnancy, the uterus remains deep in the pelvis, does not even enter the abdomen until at least the 14th week. Since the uterus is deep down in the pelvis, it really doesn't matter in what position the patient is lying down. She could lie down in any position that she is comfortable, including face down. After the 14th week, since the uterus starts elevating and coming into the abdomen, even now she can lie down either on her back or on either side. Being comfortable is the most important part of lying down. As one normally turns to one side while lying down on the back, the normal ligament structures which attach the uterus to right down in the vagina can start causing some amount of twitching or a pulling kind of sensation when one suddenly turns or suddenly gets up from the sitting position. This is normal, need not be feared, and therefore the patient can still lie down in whichever position she is comfortable. In the late second trimester, there are some conditions when the gynecologist may identify that the blood flows to the placenta are inadequate or the fluid quantity in the uterus is inadequate. Only under these special circumstances would your doctor definitely inform you that we want you to lie down on your left side as much as possible. The key word here is as much as possible, because there is no absolute mandatory requirement that the patient has to watch the position she is lying down in right until she delivers. Whenever the patient is resting, we tell them to lie on the left side. Even if in their deep sleep they inadvertently turn on their right or onto the back, it is not going to be worried about or causing any problem. Later, towards the end of the pregnancy, which is in the third trimester, the enlarging uterus being heavy, it causes pressure on the maternal blood vessels and therefore starts reducing the blood flows back into the heart. Nature's way of taking care of this is, at full term, if the patient is lying down on her back for a long time, even in her deep sleep, she may find herself getting uncomfortable or breathless and automatically turning onto her side. Therefore, again, I would reiterate here that one does not need to be awake the whole night watching whether you are actually lying on your left or inadvertently you have been lying on your back. It is not going to be any cause for concern, and therefore ultimately the patient has to be comfortable in whatever position she is lying down. Towards later pregnancy, because of the stretch on the spinal muscles, the back muscles can cause a little bit of a lower back ache. To get over this, we normally ask patients to lie on their side with the lower leg stretched out, the upper leg pulled up towards the abdomen, and a pillow to relax between the legs. This could continue as long as the patient is comfortable in this position until she delivers. Apart from this, there are few other positions that we would ask the patient to assume towards full term, of course not when they are resting, but as a part of their exercise to sit down squatting, to sit cross-legged. All these are normal, would help in an easy delivery, and therefore should not be worried about. The reason we are reiterating this here is, it is a common myth that sitting cross-legged could cause harm, doing certain jobs at home could cause harm. Unless the gynecologist has specifically asked the patient to avoid certain positions or postures, there is no necessity to be overly paranoid or worried about these positions.